My name is Jen Stolzman, and this is my mini quality improvement project discussion board post. The topic I chose was reducing nurse burnout. The problem: bedside nurses on all units frequently do not take uninterrupted 30-minute breaks during 12-hour shifts, which contributes to increased burnout and potential threats to patient safety. Why this matters: missed breaks increase fatigue, reduce vigilance, and elevate risk for communication errors and near misses. Why this fits for this project: this requires only a small change process, no staffing or budget changes, and it's relevant because due to the high census we see in our hospital and rapid turnover and constant interruptions, there are many things that make breaks inconsistent. Here is my fishbone. At the head of the fishbone is the problem: the missed uninterrupted 30-minute breaks, and which leads to nurse burnout and safety risk. Here are the environmental factors, the process, people involved, and management, the role management plays. The focus is standardized break coverage, and the plan is to implement a break buddy system. I would probably start by saying that on one unit we could implement a break buddy system, and before implementing the system we would have the nurses fill out a little survey. And my primary outcome is that within 6 weeks, the percentage of bedside nurses who report taking at least one interrupted 30-minute break per 12-hour shift will increase by 20% from baseline. Secondary outcome: within 6 weeks, the mean emotional exhaustion scores will improve by 10% from baseline. I researched a couple articles, and here are some findings for evidence supporting break interventions. Break nurse model significantly reduced emotional exhaustion. Break nurse and break buddy systems work for securing uninterrupted breaks. They support structured break coverage to reduce burnout. Rest breaks are protective against burnout. Breaks most effective when paired with leadership support and coverage processes. They support standardized break coverage as a burnout reduction strategy. For interventions that I considered versus what I selected, some possible interventions were structured break buddy systems, including mini report sheet, protected break schedule in shift huddle, phone/pager handoff protocol, end of shift reflection and reset check-in, micro education on burnout and breaks, chosen intervention, structured break buddy system with mini report sheet and break times included in huddle. Why I chose this is because it is low cost, directly addresses root cause, is easy to pilot, and measurable within 6 weeks. For implementation plan and data collection: data to collect, process measure weekly percentage of nurses taking uninterrupted breaks, outcome measure emotional exhaustion score pre and post, balancing measure staff feedback on coverage near misses, For data sources, anonymous surveys, baseline and week 6, charge nurse break checklist, weeks 1 through 6, optional staffing system break punches if reliable. And for data display tools, we would do a run chart of weekly break adherence, a bar chart pre and post burnout scores, dashboard summary, and qualitative comments. And for frequency, we would do weekly updates with a final report at week 6. Quality improvement team, roles and approval process. Quality improvement team, which I guess is me, would coordinate, collect data, present results. Unit manager would have to approve this pilot and reinforce expectations. Charge nurse would assign buddies and maintain checklist, as well as send out a message at the beginning of the shift using Epic, which is our main source of communication during the workday, which would list the break assignment buddies. And then the charge nurse would also follow through and make sure that everybody actually got to take their breaks. Staff nurses would participate and complete surveys. Quality patient safety rep would assist with measures, run chart, data validation, and this is optional, but a nurse supervisor could provide brief training. For approval steps, submit a one-page project brief, meet with manager and quality improvement rep for approval, present plan at staff meeting / huddle, launch a 6-week trial, analyze data and present results, decide whether to adopt, adapt, or spread. And here are my references. Thank you.